Addiction, which includes both alcohol and drug abuse, places a significant strain on the United Kingdom, with far-reaching consequences for the economy, businesses, and society at large. Economic impact. The financial impact of addiction on the UK economy is significant. Alcohol usage alone is predicted to cost the economy £27 billion per year, with drug use adding an additional £15 billion. These estimates include both direct and indirect expenditures, such as medical expenses, law enforcement, and missed productivity. Alcohol-related expenditures are very substantial, with the NHS alone carrying roughly £4.9 billion yearly owing to hospital admissions, ambulance calls, and other healthcare demands directly associated with alcohol usage. Impact on businesses and employment. Addiction has serious repercussions at work. Approximately 70% of people with substance use problems work full-time. The broad prevalence of substance abuse in the workplace has serious consequences for enterprises. According to Kennedy Street Recovery, 1 in every 10 small company owners have reported employees arriving at work under the influence of alcohol or drugs. This behavior not only undermines the productivity and safety of these firms, but it also results in significant economic losses. Employers lose an estimated £7.3 billion each year owing to lost productivity, absenteeism, and workplace accidents connected to alcohol usage, accounting for 17 million lost working days each year. Furthermore, substance abuse is associated to 40% of all industrial accidents, emphasizing the safety dangers that addiction brings in the workplace. These accidents, together with other productivity losses, underscore the significant economic and human costs of addiction in the workplace. The hidden risks of long-term antidepressant use. Long-term usage of antidepressants, while sometimes required to manage persistent mental health disorders, includes hazards that can harm both individuals and their working performance. While these treatments can save lives and enhance many people's quality of life, long-term usage has been linked to a number of negative side effects. Long-term antidepressant use can cause weight gain, sexual dysfunction, gastrointestinal problems, and drowsiness. These physical symptoms might lead to a decline in general well-being and productivity at work. More worrying are the potential long-term effects, which, according to current research, include an increased risk of cardiovascular disease and cognitive decline. For example, a study headed by the University of Bristol discovered that long-term antidepressant use may increase the risk of heart disease, raising worries about the prescription's long-term health consequences. In the workplace, these adverse effects might lead to greater absenteeism, lower productivity, and higher healthcare expenditures. Employees may have fatigue or attention challenges, limiting their capacity to function properly. Furthermore, emotional numbness and mood changes in some people can disrupt interpersonal connections at work, hurting team dynamics and overall job satisfaction. While antidepressants are vital for many, it's critical for both employees and employers to be aware of these potential hazards and to urge ongoing discussion with healthcare experts to ensure that treatment stays effective and safe in the long run. Social and health implications. Aside from the economic consequences, addiction also poses major social and health risks. The Northwest region, notably cities such as Manchester and Liverpool, has some of the highest rates of alcohol dependency in the United Kingdom. Underfunded treatment options and high levels of social deprivation in these places aggravate the social costs associated with addiction, making it harder to handle the issue effectively. The COVID-19 epidemic exacerbated these issues, as increased stress, isolation, and economic uncertainty led to an upsurge in substance abuse across the UK. Yorkshire, the East Midlands, and London have seen marked rises in drug usage, with a major spike in both consumption levels and dependence rates. Addressing the crisis, efforts to reduce the impact of addiction necessitate a holistic approach that includes more funding for treatment programs, stronger regulation of substance availability, and improved education on the dangers of substance abuse. Investing in prevention and treatment initiatives benefits public health while also providing a high return on investment. For example, drug and alcohol treatment programs in the UK generate large economic benefits, with every £1 invested in alcohol treatment providing a return of £3, which can climb to £26 over 10 years. To summarize, addiction in the UK is a complicated problem with significant economic, social, and health consequences. Addressing this issue needs coordinated efforts from multiple sectors, including healthcare, business, and government, to minimize the prevalence of substance abuse and its negative impacts on society.